in a twin pregnancy, there may be a situation where one baby is growing and developing completely normally, but the other baby has any problem. And that may be a minor problem. It may be a question of growth, or it may be a more significant problem. And clearly this becomes a much more complicated pregnancy, because how we manage the pregnancy has to be a combination of doing what's safe for the baby that's growing normally, as well as doing everything that we need to do for the baby that has a problem. And how we manage those pregnancies does depend to a very large extent on whether these babies share a placenta or not, i.e. whether they're a monochorionic twin pregnancy where they share a single placenta, or whether it's a dichorionic twin pregnancy where each baby has its own placenta. And the reason why that's important is that when it's a dichorionic pregnancy and the babies have their own placenta, what happens to one baby doesn't have a direct impact on the other baby. But when there's a monochorionic twin placenta, anything that happens to one baby can have a direct impact on the other baby, even if the other baby is developing quite normally. And so we need to look at that first and look at how or what impact any problems can have on the whole pregnancy. And so it's very much a holistic approach. But the important thing to say is that we are a specialist unit for multiple pregnancies, and we get referrals from all over the country for complex multiple pregnancies. And we know that we can manage these pregnancies to hopefully allow both babies to continue to develop and deliver both babies in a healthy condition. But if the situation is much more complicated than that, then there are other treatments that we can offer to try and give both babies a chance. But if it's a situation where it's only one baby that's going to have any chance of survival, then again, there are management options that we can do to try and optimize the chances for that baby. So even if you have a multiple pregnancy that's complicated, it's important to just have the confidence that there are people that can help.